Newsmax at 7.
Welcome back to Orlando Matters, talking about the debates and the role of Medicare in the debate. This is going to be fascinating to see whether Mitt Romney or President Obama does a better job explaining their positions, especially in Florida, where we have so many seniors who are relying on Medicare. Go ahead and give me your thoughts on that.
Now, Medicare, I've heard from the left the premise that we want to change Medicare as we know it. Well, the fact is that Medicare is changing as we know it. It's going bankrupt if we keep the status quo. Now, one way we can solve that is to have worse health coverage where people are dying at a younger age so people don't live past 65 and have more years on the government program. Social Security, Medicare, the good fact is our life expectancies are going up and up. The bad news is they're still kicking in at the same time, so we need to come up with solutions for that. The Republicans have put a lot of things on the table, from raising the age in which it kicks in, from means testing, whether or not you get the capability. But yes, there is an option that is an option at people 55 and under, that they can decide to take a voucher and go to the free market and comparatively shop and go for a plan that is best for them. This is, at the same time, they can keep under the current Medicare plan. And we've seen in the medical field, when people have an option, service increases and prices go down. Take, for example, LASIK. LASIK over the last 10 or 15 years have gone down in price dramatically. The reason why is that insurance does not cover it. They need to market themselves to the individual consumer, and with that consumer feedback, they're always looking to reduce costs and increase service. Now on Obamacare, the pre-existing coverage. I understand that people like that, and I would too, and not saying that we shouldn't have a pre-existing coverage, but at the same time, you cannot market Obamacare as reducing costs and increasing pre-existing coverage, because what happens is pre-existing coverage is you're going in and getting insurance after the fact that you have an issue that's going to cost more money to the health insurer than you're paying in dues.
Which is why Obamacare provides preventive and gives people more the ability to go in and seek preventive care, so you don't get to that point.
Think of any other insurance. Can you have pre-existing coverage for a car? Can I wreck my car, get a fender bender, call up State Farm and say, I would like to be insured, and the first thing I'm going to do is give you a $5,000 bill for my $2,000 a year payment.
But the public still pays for the ambulance to come out. And
now, if we are going to have pre-existing coverage, and I think a lot of us would be okay for that, then don't at the same time say that the rest of our premiums are going to go down. They're going to go up because the insurer is going to lose money on those percentage of people that have pre-existing coverage that the rest of us are picking up. Now, that may be a fine argument, and I'm not saying that's not the wrong way to go, but I think Obamacare was misconstrued as saying we're going to give you better quality, lower costs, and pre-existing conditions without any downside. But I think now we're seeing the downside.
That's why they expanded the pool to include everybody to pay into it, and that was where the President Obama ran into so much interference, so to speak.
That's the whole idea behind insurance, is that if you expand the pool, it drives down the risk. I mean, the problem you have here is that the assumption that that the private market, which has to make a profit to be, they have to be profitable in order to exist.
Sure.
You're going to have insurance companies that decide that I'm not going to cover folks who have pre-existing conditions because they're too expensive. I'm not. And the problem, the whole problem with this to begin with, is that we have an employer-based healthcare system in this country. The people who are least likely to need expensive forms of healthcare, or the least likely to need treatment, are the folks who get up every day and go to work. It's the folks who, the developmentally disabled child, the senior citizen who just got diagnosed with a life-ending medical treatment, unless they're treated at a very high level of medical programs. You have somebody who maybe have gotten a chronic condition, who can no longer go to work.
And I understand that there is a need for a safety net, but instead of 95% of the people were happy with their health coverage going in pre-Obamacare.
I totally disagree. I completely
And instead of focusing on those 5% that are truly needed, that truly can't afford it, that have pre-existing conditions, and expanding Medicaid or an existing service
How is it okay?
He reformed the whole the whole
How is it okay that I go in and
of our economy.
I go in and give birth to my child at a hospital and I get charged $18 per ibuprofen under the free market healthcare system or the employer-based healthcare system right now? We have medical companies that are charging $18 per ibuprofen to these insurance companies.
Guys,
we've got to get a control on these costs.
We are out of time. Thanks for your spirited debate and insights. That's a wrap on Orlando Matters. We'll do it again next week.